Good evening and welcome to the Health and Overview Scrutiny Committee. This is the first meeting of the new municipal year. My name's Councillor Alison Swaddle and I am chairman of this committee. With me tonight we have Councillor Jackie Rance, Vice Chairman of the committee, and Councillors Adrian Mather, Sam Akhtar, Jenny Cheng, Carl Duran, Michael Firmager, Tahir Mahir, and substituting for Councillor Patman, we have Councillor Norman Jorgensen. Madeline, do we have any apologies?
Just Councillor Patman.
Thank you. Right, turning to item number 2, the minutes of the previous meeting. Does anybody have any comments on these minutes, or are we happy to sign them as the correct record? Okay, I will accept that. Item 3, do we have any declarations of interest this evening?
Yes, I have a declaration of interest. I need to explain why, do I?
Yes.
I'm the Wokingham Borough Council representative on Berkshire Healthcare Foundation Trust as a governor. So I'm on the Council of Governors.
Thank you, Jenny. Any other declarations? No. Okay, item 4, public question time. Do we have any questions? No. Item 5, members' question time. No. Right, so moving on to item 6, which is an update on the mental health support for the vulnerable communities in Wokingham. We're going to receive an update on mental health support across the borough. I believe we've got Ingrid and Andy with us this evening. And we have also invited members of the Children's Services Overview and Scrutiny Committee to join us, as this item will be looking at adults, children and young people. So welcome on Teams to councillors from the Children's Services Committee. And of course, Norman is here, Chairman, with us this evening. Right, Ingrid, would you like to take us through this?
Yeah, thank you very much, Councillor Swaddle, Chair. So thank you very much for having us here this evening to discuss our children and young people's mental health and wellbeing at a very important time. And thank you also for your flexibility. I know that these questions came up at the end of last year and you have allowed us some period of time in grace given the ongoing COVID situation. We were hoping that might have calmed down for the summer, but unfortunately not as of yet. I'd also like to just introduce Andy Fitton, who's the Assistant Director of Joint Commissioning at Berkshire West CCG, who's very kindly agreed to come along tonight with me, largely because most of our children and young people's mental health services are in fact commissioned by the CCG as opposed to directly being commissioned by ourselves. And then last, I just want to mention, I apologise, my husband is working and I have 3 small children who've been put to bed early. So if there's any noise in the background, that would be why. I'm going to share a short presentation based on the report that we've submitted that will enable us to talk through some of the issues. If you could let me know when you can see that.
Yes, we can.
Super. And then obviously I can't see anyone, so if anyone has their hand up or would like to interrupt, please obviously do, but someone might need to shout out at me to let me know. So we're here tonight to discuss and to report against the questions that have been posed to us from previous overview and scrutiny committee meetings, which are listed here. And I think just to set the scene a little bit, I think that we all are here because this is a really important issue that's not in dispute. We know that nearly half of all mental health problems experienced in adult life will have begun by the age of 15, and indeed 3/4 of mental health problems in adult life will have begun by the age of 18. So actually looking out for our young people and their mental well-being is extremely important as a preventative measure for ongoing mental health problems. And quite clearly and obviously poor mental health in children impacts young people as they and impacts their future life chances as they grow and develop. They're more likely to have poor educational attainment, poor employment prospects, and poor social relationships and physical health, all as a result of mental health problems through childhood and early adulthood. Early intervention is obviously important, and it provides an opportunity to reduce the health inequalities that result, particularly for vulnerable young people. Whilst your questions didn't directly mention COVID, clearly there is an underlying context of the impact of COVID and what that will do to the mental health and well-being of all of our residents, but particularly our children and young people. The impact of COVID is largely still unknown, and I think we have to recognise that. Everyone within public health, within the local authority and within the wider healthcare system will clearly work over the coming months and indeed years to try and understand the impact that COVID is having on and has had on our young people. Clearly, though, it's not going to be a leap of imagination to think that actually there's going to be quite a lot of negative impact from the past year on children's emotional well-being. There has also been some, let me point out, research about the additional benefit of being at home with both parents for a prolonged period of time. But I think that in terms of the lockdown, in terms of missed school, in terms of missed education, in terms of missed social interaction, and all of the things that we are so familiar with, sadly, from the past year, we know that that will have had negative impact on many of our resident children and young people. So I think it's reasonable to expect that there will be a growth in the number of children and young people who need access to services for emotional wellbeing and mental health, although the actual impact and the numbers around that remain very difficult to predict. So just in terms of setting the scene before I hand over to Andy to talk about some of the services more specifically, what we do know a little bit about mental health and young people around COVID is that there was a survey, a self-reported survey which PHE have published, showing that mental health and wellbeing has worsened since the beginning of the pandemic, and that although this was in older people, there is a high level of anxiety and low level of happiness around the first national lockdown, which has endured. So we have no reason really to believe that those national trends are likely to be different in Wokingham, although clearly it's too early for us to know specifically the impact on our residents. We are, as a public health team, working with partners to understand those impacts, and we are aiming to publish a local mental health needs assessment which will cover the whole of the life course by the end of this year to help us in our planning, future planning for the coming period of time. So the current services for children and young people include the CAM service, which includes our Berkshire Eating Disorder Service, which I know Andy's going to talk to. Those are commissioned by the Berkshire West CCG and delivered by BHFT. There's the Mental Health Support Team project, which is for local secondary schools, and then a new Tier 2 offer to support emotional health and wellbeing among children and young people, which is jointly commissioned by the local authority Children's Services and the CCG, which is being delivered by BHFT. Just before we go on, I think having introduced Andy, I didn't introduce myself, so I'll just finish by saying that I'm Ingrid. I'm Head of Public Health at Wokingham Borough Council, just not quite at a year of service yet, but coming up to it. So many of you I might have come across through COVID work, but if not, nice to meet you this evening. And at that point, I'm going to hand over to Andy.
Thank you, Ingrid. So I don't know if there's any questions first, Chair, unless you'd like me just to carry on. So
no, please carry on, Andy, and welcome to the meeting.
Thank you for inviting me today. As I already said, I work for the CCG and we are the commissioner in an NHS landscape where you have a commissioner like ourselves, and then already mentioned Berkshire Healthcare Foundation Trust being our primary provider of specialist mental health support, and we'll come on in the slides to talk about what you might call the earlier intervention type offer in the community. What we're covering at the beginning is looking at these what we might call ideally called specialist mental health support for children and young people that have quite an escalated condition. And you're right to assume that a lot of those will be around anxiety and depression, that often might be seen in the behaviour of self-harm. But also we're going to talk today about the impact on eating disorders, which has a national as well as a local profile worth considering. So you can see that we're sort of painting a little bit of a picture of what is it that we're looking to offer. It is about a mental health condition that is governed by NHS NICE guidelines, like many other NHS services, about how you would then treat that presentation going forward. And I think it's really important that we have something called CPE, or Common Point of Entry. And just to explain a little bit, that's almost like our front door, a bit like we have local authorities have their social care front doors. That's our NHS mental health front door that's run by CPE. And you'll see on the graph on the right, top right hand corner, a really interesting year for us in terms of the volume. So you can see that it is very much affected by the COVID experience. So where we are right now, from a low of 42 referrals in the month for Berkshire West. This isn't just Wokingham data, so that's across all three local authorities of Reading, West Berkshire and Wokingham, to a significant high of 336. And a lot of that's to do with lockdown, and a lot of that's to do with access to professionals and support like schools to identify children's needs. Particularly that first period from the number 42 to 56 is also, we know that people withdrew very massively from using even primary care, which was another route into CAM. So that experience is quite significant, and you'll see from the sort of 115 figure upwards, that's the upward curve that we're worried about. And that, obviously that's just taking us to the end of the financial year. Things have calmed down a little bit in the last couple of months, but not back down to that low that we're talking about. So we have a lot of young people that you could argue this concept of surge that we're expecting at some point to come through, haven't quite seen it. So that's the CPE piece in that respect. And from there are two significant teams that we're going to just focus on at this slide. One is called the specialist CAMS team, and the other is called the anxiety and depression team. And you can see that as of the end of March, the table there talks about the number that are waiting, versus that's the first column, versus the third column of those that are actually in treatment, and that's again Berkshire West figures, and it gives you a sense of how many are actually therefore we're having to manage as a team of people that are offering services to those groups of children and young people. Should we go on to the next slide, Ingrid? So the other significant
Andy, could I just ask, the figures in treatment, do you have a breakdown for the number that are in Wokingham in the way that you've been able to break down the numbers that are waiting?
Yeah, unfortunately the information I had didn't give me that, so I can go and ask for that. I'll be really honest, I didn't bother the service too much. I used information that was available to me in the CCG because I obviously want to keep them focused on their service delivery. So, but I'm very happy to take requests of information back to the service to get that for us.
That's great, thank you.
Okay, I'll just make a note. So the eating disorder service is a very specific team set up 3 or 4 years ago that actually used to be part of the specialist CAM service in response to a national drive to have a specific clinical input into that service. And I think, I suppose the overall position here is that the bed service, as it's called, which is for 8 to 18-year-olds with a very specific eating disorder condition, actually has had a really difficult year with the numbers overall, and you'll see that actually really that they have gone up or above the average monthly amount pre-COVID. And again, I think I hope Ingrid would concur, this is a national position, it's not a Wokingham specific or a Berkshire West specific position, and we've seen that being both not just in terms of numbers coming through the door, but actually the complexity of those children's presentations has been significantly higher than we've experienced before, which can present itself as being needing a more urgent response to their weight loss, or they've got comorbidity with particular conditions like autism, which means that they've got to be a more thoughtful response to their needs from the service. And so you can see that what we're also experiencing both regionally and nationally, which is not at this slide, but something to consider in terms of eating disorders, is a lot more children needing to go into what we would call an inpatient unit. So they're actually moving from a community service, often being presented at the Royal Berks. They're getting stabilised in terms of their presentation or physical health, and then actually what they do need is a more longer stay intensive treatment for their mental health condition, and they'll move on to a inpatient ward somewhere in the region, hopefully as local as we can find as an NHS. But actually those numbers demanding and needing those places have gone up again through COVID, and it is a significant issue for the NHS that we're working on to meet that need across the region. Okay. So effectively, I suppose the other thing to really cover here is that we have a level of service that sits below what I suppose is the need of a specialist CAM. So it's almost like an emotional health and well-being or early intervention mental health service. What you can see here is that we've done some fantastic partnership work over the last year, where we've looked to review how, as a partnership of services and statutory agencies, we support children and young people with their needs, and in particular recognising also the impact of COVID-19 over that period of time. We've ended up being able to propose a completely rethought through and reshaped emotional well-being model for children with mild to moderate mental health needs, what might be called as a tier 2 service or early intervention. And actually that's been in conjunction with listening to children and young people themselves, their families, as well as schools. And it's a kind of a mixture of assessment and direct intervention, as well as training and support to providers like schools, who can then identify and help children as early as possible. We are looking to, and the current thing of setting up some kind of emotional health assessment and triage service that would act as the front door locally to Wokingham, and it's been it's going to be called an emotional wellbeing hub. We're going to be using that as a central point of contact for a range of people, including families, young people themselves who can refer, as well as professionals like we've described as schools, maybe even GPs. And effectively what that's looking to do is to bring the need into a space which is a space that's created for a multi-agency response to meet the needs of that child and their family as it's presenting at the time, which might require a mental health professional, but it might require some advice and then some intervention by another professional, or it might need a combination of those things going forward. So that is being mobilised as we at the current juncture, and Woking Borough Council are leading on that development of that service with BHFT. Something that we've spoken about in other committees is we were awarded funding a year and a half ago to set up Wokingham's first mental health support team. This is a government funded initiative that is England wide, where they are within 10 years hoping to have a mental health support team available to every single school pupil 5 and over within 10 years. And effectively it's a dedicated team to a cohort of schools of around 8,000 pupils, so a mixture of secondary and primary school. That would include a range of specialists, like a senior educational psychologist or a specialist CAMHS practitioner, alongside some people that are going to be trained through the Reading University setup that we have here locally to become what we have called educational mental health practitioners. And what they will do is a lot of support, engagement and direct intervention with children, particularly around anxiety and depression, which is probably the most common feature of mental health need in places like Wokingham and Reading and West Berkshire. We have one team. We recognise that actually what Woking will need as a minimum within 10 years is 3 teams. We're one of the first areas to get teams, and others are now catching up, so we've got to be patient and wait for our next allocation of resource. And And we're really excited about the early evidence of this coming through, that they are supporting children and young people, and the referrals are mainly coming through as expected for anxiety and worry that early adolescents have around year 7 through to year 9. We recognise that probably with the significant housing developments that are going on in Woking, it might be that they need a 4th team eventually, but from the data we've got right now, it's 3 teams that would cover that. So we continue to work with NHS England, and when funding becomes available, we will seek an opportunity to build more teams.
Great, thank you, Andy. I'm going to take this bit on, which is around some of our prevalence figures, or some of our data. And unfortunately, data around under 18s mental health disorders is not great. I'm going to caveat something before we look at this and talk about what was called the Mental Health of Children and Young People in England survey, which was carried out in 2017. So this is pre-COVID, but it gives us a kind of idea about what we might expect within our population. So this was a survey that was carried out across England, but is believed to be fairly generalisable to local populations. And that survey concluded that about 11%, just over 11.2% of 5 to 15-year-olds have a mental health disorder in its broadest terms. So that includes, as we've got here, anxiety, depression, includes the eating disorders Andy's spoken to, but also includes some behavioural difficulties in some of the younger children, and is a much wider definition. So based on this, the estimated number of children and young people with a mental health disorder in Wokingham 5 to 17 would be around 3,500. The mental health survey at that time also found out that amongst 11 to 16-year-olds, boys and girls are actually equally likely to have a mental health disorder, which I think feels slightly counterintuitive, but that's the findings of that survey. And that, as we've discussed just now, that emotional disorders or anxiety and depression are the most common type of disorder in this age group, and that it's the prevalence in that age group nationally is about 1 in 7 11 to 16-year-olds have an identifiable mental health disorder, with, as I say, anxiety and depression being the most common. Once you move slightly above that, so between 17 and 19, it changes. So it's only slightly more common. 1 in 6 have a mental health disorder. But at this time, between 17 and 19, the girls, females, young women at that point, are then twice as likely as young men to be diagnosed with emotional disorders, predominating once again anxiety and depression. So the data that's presented here is limited, and it's limited because it comes from general practice or primary care data. So it's not looking at anyone who has a mental health or wellbeing disorder outside of reporting it to the primary care FAT teams. So unless you've been to the GP and been diagnosed by the GP, you wouldn't be represented in these figures. So it's a lower estimate than we would consider would be within our communities. And you can see here this female-male difference. Now that might be because we've included 17 and 18-year-olds in this. It might also be because young men are more reluctant to present with their mental health and wellbeing disorder. That's difficult to obviously tell from this data. What it does show is, exactly I've just described from that survey, is an increase in both anxiety and depression by age, which is exactly what we would expect to see, and some obviously some gender disparity when including 18 up to 18s in that data. So that's what some of the data shows for us locally, and as I say, it is limited and subject obviously with COVID upon us to change, as Andy has shown within the services. We are expecting an increase in these diagnoses over the coming months and potentially years. Moving sort of on to another area within your within the questions, which was around the work going on in suicide prevention. So public health lead on suicide prevention, and it's part of the Berkshire Suicide Prevention Group. So we sit on this multi-agency group that has been set up some time ago to collaborate on surveillance initiatives to combat suicide. And perhaps pleasingly, suicide rates across Wokingham and neighbouring boroughs haven't changed since the start of pandemic. So whilst other areas of mental health and wellbeing have changed, suicide numbers have not increased at this point. Whether we would, obviously we need to continue looking in the years to come. But as you can see there across, this is all of Berkshire. There were 61 suicides reported in 2020, and that is compared to 66 and 62 in the previous years. So in 2020, there were 9 residents in Wokingham who had taken their life, and 2 of those were under the age of 18. This subgroup, the Berkshire Suicide Prevention Group, has looked at the surveillance data, and it was noted that there was a small spike in female suicide, so an increase in the ratio of female to male suicides was noted, and so a subgroup was set up to look into that in more detail, and actually that was discovered to be an overrepresentation of health and social care workers sort of a few months into the pandemic, and women in other supporting frontline roles. So in light of this, BHFT is amending their safety plan to look at how they can improve support for staff, and particularly at times of high service level and demand. So that's just a summary of the activities in this area over the past year. And then I'm going to hand back to Andy for the update on Willow House.
Chair, this is Willow House, people may also know, is our local inpatient facility that is run by BHFT. So that is commissioned by NHS England directly rather than by the CCG, but I think you would like to understand what's going to happen with that facility, because I suspect you may have heard that actually it's changing going forward. So we wanted, and we were working with NHS England to have Willow House move from its current Wokingham site onto the Prospect Park Hospital site as part of the redevelopment and refurbishment of some of the facilities there. And that was all announced a while ago, before COVID. If there was such a thing before COVID, sometimes you wonder, that there would be an increase in the number of beds made available for children and young people in Berkshire who needed an inpatient facility. However, they have recently done a review, both of the number of beds available, but more importantly, looking at alternative provision across the country that is showing an evidence base for supporting children and young people with this type of need, but in a different way, particularly looking at other parts of the country. I think if we're going to create up in the Midlands, Lincolnshire area, they've started to see the ability to change the provision from a residential bed-based provision to a intensive support and keeping the child or young person within their home context, actually living at home. And that had shown some really good outcomes in terms of recovery and also not disconnection with their community, their friendship groups. Obviously, we know that once you take a young person away from their community, there is some negative outcomes, obviously unintended, that can happen as a consequence of that process. So we were part of a process with NHS England to review that decision, and BHFT made an agreement that actually what they will do is evolve the current plan into a very different and unique offer for children and young people here in Berkshire, in Berkshire actually, because it was a Berkshire-based service. So effectively, they'll be moving to a new service model that is looking to enable children and young people to remain at home and have an intensive 7 days a week, 365 days a year offer as they need it. Through some what's described here as an extended daycare program that runs from 8 a.m. to 8 p.m. on Monday to Friday, and then on weekends and bank holidays a working day time. And what the family will get is ongoing intensive support from clinicians who will meet their mental health needs of their child and work with them more within their family context. There will continue to be an education offer, although they won't be going to their education facility, their school that they were on roll with before this service. They will join the service that will continue in Wokingham. We look to try and make sure that we can sort of keep that child safe and recovering quicker at home, and stay connected with their community going forward. The new service team will continue to be multidisciplinary of a range of psychiatrists, therapists, nursing and teaching and support staff because of the education requirement. So that has already started. So Willow House has effectively not stopped being an inpatient facility, but now we have this new service. One of the best bits of it is that we will now meet the needs of more young people. So this service can work with 16 young people at any one time, whereas currently we've only ever been able to have 9 people in Willow House for Berkshire. Just to assure you, if a child still needs a bed, an inpatient facility, that will continue to be available to all Wokingham and Berkshire young people. The process would be that when a young person is highlighting the need for an inpatient facility, that is assessed by a consultant psychiatrist. And in consultation with the people running this new service, plus the people that run the bed service in the wider region, they will assess the child and young person's needs and take the best action for that child and young person. So effectively what it does is it just adds another offer to the position where they're making decisions. So if a child still needs a bed, there still will be that option, often at Oxford, or continue to work with the Maidenhead provider and so on. So this is what we perceive to be a good news story, and we're really excited about seeing it develop over the coming months.
Thank you, Andrew. And that brings us to the end of that talk through for you around the report. But if you have any questions, obviously, Andrew and I are here to answer those and discuss them with you.
Okay, I can see members with hands up. Michael, would you like to begin?
I got your eye first. Thank you very much. Yeah, it's just I know that Andy made mention of this earlier on about MHST, about the bids that were made to NHS England. I'm just really wondering, you didn't really say what the results of those are. If you haven't got the results, when are you thinking that you might have them? Really, that was it.
So in terms, do you mean future MHSTs or because the current one we've kind of covered? Is that right, Councillor?
Oh, no, it's just on page 15. It says here, and I quote, Wokingham have made bids for future funding from NHS England to enable 2 further MHSTs, which will provide full coverage across Wokingham.
Yeah, so at the moment we don't have that resource to bring to Wokingham, but we will continue to go forward advocating as best we can for Wokingham to get more teams.
So, yeah, I mean, it says here that bids have been made. I'm just really wanting to know what is the results of those bids. Do you know yet?
Yeah, that Wokingham unfortunately won't be getting a team in the near future, unfortunately. So
are you looking to do further bids, I presume?
Yeah, when the opportunity arises. So where we are is that our new process is that we work across something called the integrated care system, which includes us in Berkshire West, Buckinghamshire and Oxfordshire. And what NHS England now ask us to do is to put together a bid to think about where we would put resource next for the MHSTs across a wider patch than just Berkshire West or even just Wokingham. So I'm working with colleagues in that broader region, and when we get invited, we'll work obviously with colleagues here locally to make sure those bids can best represent the need across what now is quite a wide patch that we have to consider.
Yeah, I mean, that's good to know, but I would hopefully hope that Wokingham is not watered down by going to a bigger area, that somehow Wokingham doesn't get a good deal.
Okay, Clive.
Thank you, Alison. Thanks very much for the report. It was a really interesting report. Can I ask a question about children who are diagnosed with eating disorder? You say that there's no, in the report it says there's no historical data available, but it's suggesting there's about 28 of the 38 children are female and 10 probably male. Is there any anecdotal evidence to suggest that it's increasing or decreasing for either of those groups?
In terms of data, I don't have anything that tells me whether it's increasing or decreasing based on gender. I think we've always seen people that have worked in the service for a long time tell me that it is a historically usually a female higher referrer than male, which is not unusual. Yep. I think from that perspective, apologies that we don't have necessarily a longer history to give you, but that's, I suppose, an experiential feedback from service providers. So I would imagine, but I can check this, is although numbers are going up, I don't think we're seeing a change in that proportionality between gender going forward. But I can check. I don't have that data to hand, but I can ask for that if that's something that the committee would like.
Yeah, if you could, and maybe update us in a future years. Can I ask a question about some CAMS support? You've got eating disorders, anxiety and depression specialist CAMS teams, that the average waiting time for the assessment, I guess, is 15.2 weeks. That doesn't include all CAMS assessments, does it? That's just those particular ones.
So to deal with waiting times, there are two parts. One is that you might have to wait for your time to be assessed by common point of entry. And I think we've given you an average waiting time there of around 7.6 weeks. And then on top of that, you then get, once you get through that process, you might be offered to go into a particular team based on your presentation. So what you're then seeing is a waiting time from that decision to then starting your intervention with the anxiety and depression team. So that's 15.2 weeks.
15.2 weeks. Does that include an assessment for ADHD?
No, it doesn't.
No. So those ones are still up at around a year or even longer.
Yeah, I haven't brought that data with me today, but yes, it is significantly longer.
Okay, and we've been able to get these down to 15.2 weeks because there's been some government-funded assistance.
Not necessarily. I mean, it's all through CCG funding. Both these bits, and they're all come through the CCG funding pot. And I don't know. Again, you're testing my memory here in terms of trends, in terms of up and down. Often it would be somewhere around that time. I don't think it's come down significantly, councillor, necessarily for anxiety and depression. It's come down, it goes back up. There's a little trend. It does waver based on referral numbers and complexity of presentation, so they stay longer in the service.
So it's always been around 3 to 4 months.
I can again check that. Hopefully, I mean, I don't have that data to hand.
Okay, and then just one other question, if I can, on page 15. You talk about how many. I'm getting confused with my own notes here. I'll come back to you. I'll be back in a minute.
Okay, members, you don't need to keep your hands up. I do support you quite early on. Right, I saw Norman. I'm going to go to Norman, then Adrian, then Sam, and then back to Michael. Okay.
Thank you very much. Again, on the Woking Mental Health Support Team project, you said there were some promising early results. Are you able to give us more of an indication of the sort of enhanced outcomes that you're seeing, or that you would hope for even?
So I can get that data and share it with you, but in terms of they've only been running for a short period of time, about less than 6 months. So it's encouraging that we've had 67 young people already referred in for that support, which is encouraging considering some of that period of time was lockdown as well. So I think we should see that as encouraging that families and children and young people want to use this service, and teachers are promoting it really well. The kind of outcomes we'd be expecting is, because they're using evidence-based tools, would be around scales of change. So the way that usually when you're working with anxiety and depression is it's in a consultation with the child and young person, you try and help them measure their current level of anxiety at the start of intervention. And then they often use a much more child-friendly cognitive behavioural therapy approach that will then allow that child to learn how to manage their anxiety and depression better through, well, cognitive. I'm probably not the best person to explain, but essentially it's about trying to help people think and behave differently. You are going to feel anxious, but can you react and cope with it better? And so at the end of the intervention, they would also look to do some evidence-based measuring that would see whether the child or young person or pupil is saying that their anxiety or depression has, feelings have changed over that period of time. So that's the kind of outcomes we'd be looking for. The other significant intervention they do is often they do a lot of group work, but also looking at supporting parents. So we know by evidence that actually when we support parents, helping them understand what their child is going through, it can make a significant difference to the home environment and how that child's anxiety can change. And so that's also something we'd look for parents to be self-reporting through their interaction with the team, that they feel more skilled, more knowledgeable, more confident to work with their child, because we know a carer and a parent can have such a positive impact on children's lives.
Right, thank you. I just wondered then, do you often get people coming back again, or are you usually able to help people get a workable solution for them?
There's probably no rule of thumb to it, because it can work. It can be a life episode, a particular moment in time, often fueled by things like exams, peer network changes, divorce, death in the family, all these kind of life events can actually make a difference. The other thing, it can be intrinsic to the child and who they are, and then they're going to have to come back to that coping mechanisms and think about their strategies. And sometimes it can be just a light touch intervention following on from more intensive to help them recall and remember the things that made the difference. So I would say it's probably not a rule of thumb, but it's hard to say, but it would be a combination of those factors.
I'd just like to remind the Children's Services Overview and Scrutiny members who are with us on Teams that you are very welcome to ask a question. So if you just put your hand up in Teams, we'll keep an eye out and invite you to put your question. Meanwhile, the next person on my list is Adrian.
Yeah, I'm looking at these, your pipeline effectively, which is your CPE referrals, and this is a huge increase to 336. I just wanted to get a feeling, obviously this is the input pipeline. What's the actual situation in terms of number of patients, if you like? I'm not sure what to call them. Patients sort of in flight being supported and serviced by your capabilities.
So the best I can give you is on page 14, the table I've got gives you a sense of the caseload of the two teams that are of significance today, which is the specialist CAMS teams that had across Berkshire West, and the chair's already asked me to get Woking figures, which I will endeavour to do. We've got 477 at the same time at the end of March, and then in the anxiety and depression team we had 279, and then in addition to that, some are going through a specialist assessments on top of that. So you could see that we have over 500 in the specialist CAMS team and just over 300 in the anxiety and depression. If I could find some discharge numbers, because you're right, I think it's right. You want to know what's the intake versus the outflow piece.
Exactly.
Yeah. So that obviously, sorry, I didn't provide those data, but I can find some of those. But I think what's really important to recognise, the number for the CPE, the graph above that on page 14, the 336, not all of those will necessarily need to go on to a specialist CAMS. They may well be diverted to other offers like the tier 2 offer or they can offer something from the voluntary sector like an ARC youth counselling. We have something called the Andy Clinic, which is run by Reading University, which is a lower level anxiety and depression service. So not all those 336 necessarily have to flow in. Our usual rule of thumb for referrals into CPE is it's somewhere around the 65 to 70% of those go on to a specialist CAMS service. Actually, that 336, we noticed there was a lot of people that didn't. It was probably lower. I haven't got the exact number, but the intelligence I've had back is that that 336 was actually quite a significant build up, that actually many of those didn't need CAMS, and they were working very hard with the family and with other providers to find an alternative. So not all of those would have ended up in those two teams necessarily.
I noted at the beginning of your presentation, you said that Woking Borough Council is sort of leading with the definition of these new services and multi-team collaborations. And I think that that's really good to hear that our council is trying to lead in these areas. One thing that really concerns me, and I went to the last planning meeting where we talked about the SDL, the strategic development location, South Woking, where the CCG declined to participate in setting up a GP service for that area. And you correctly said in your presentation earlier that there will be a significant increase in houses around the borough, and particularly Wokingham. And you said that there are 3 teams relevant for Wokingham, and that there might be a need for a 4th team. I would like to be kept abreast of your algorithm or the way you decide on where you cite these teams. One of the reasons for that is it relates to Michael's comment earlier about the service specifically for Wokingham. Obviously, we're Wokingham councillors and we want the best service here. But one of the things I was thinking about was some of your statistics and KPIs. Some of them I really appreciate you coming here and showing us your informative report. But looking at the UK level or English level or whatever, I'm really interested in Wokingham. So one of the comments I would make is now we've got a Bob aspect, Berkshire, Oxfordshire and Buckinghamshire. We've got 3 areas. I would actually like to understand specifically the Wokingham values, which I think a number of our colleagues have mentioned. I want to know all the Wokingham KPIs, but also the comparatives against Bob, against Oxfordshire and Buckinghamshire, because this would give us an indication on, how we are comparing against other areas.
If it's okay, Chair, I'll respond to the MHST point. So the single indicator that we use for scale is there should be 1 team for every 8,000 pupils. So at the moment, Wokingham, forgive me if I get this wrong, colleagues, but I think it's somewhere around 28 to 29,000, something like that. So I appreciate that over time it appeals with a school building programme, which I think is underway. There will be more pupils in Wokingham than we currently have today linked to your housing programme. So we would keep an eye on that in terms of the 1 team per 8,000 going forward. I'm afraid, sorry, you're talking a little bit out of my responsibility for some of the other issues. And I don't know if there's other colleagues from the CCG here today who might be able to help with some of the other questions a bit broader than I'm afraid I'm.
Just moaning, really. I was just moaning about the GP service. Sorry.
I would hate to put it that way, but I can pass that on, Councillor, if that's helped. But I do apologise. I feel a little bit caught. I don't think I can answer your point there.
Okay, Adrian, perhaps we can look at that when we discuss the forward programme. Okay, Sam.
Hello. So looking at the figures here, it says at the end of March 2021, there were 55 Wokingham CYP waiting for CP screening, and the average waiting time is 7.6 weeks. So then can you tell me, so after this point, so they've been seen by the CPE screening team, they then have to wait a further 15.2 weeks for service. So that's around 22.8 weeks, so an average of 5 months. It's quite a long time. Is what's being done to support these people in between this time, and could this time be brought down?
So we have about to start discussions about putting some increased investment into CAMS over the next 3 years as a programme to try and reduce the waiting times across both the eating disorder, specialist CAMS and anxiety and depression teams. So yes, something can be done, but we're in process of finalising the plans around that. And it's going to take a 3-year time period, because it's not just about the money, it's about the workforce. Like many public sector organisations in the southeast, finding skilled, experienced practitioners that we need for these types of service takes time in that respect. Support whilst waiting is another area that we're going to explore in more detail, but there are some already support. So schools are often offered advice and consultation while they're waiting, and to make sure that we can continue to help. There is an online service like Kooth, which we've set up in the last year, that can support young people all year round online, that can be made available and is encouraged to access straight away. So there is support, and we are going to explore more of those options, because we feel that's something that could be of massive benefit in the short term.
Thank you.
Okay, I know Michael and Clive both indicated they'd like to come back with another question. Michael.
No, I didn't. I'm all right. I'm fine, thank you.
Okay. Oh, so Clive, you've remembered your third question now, have you? And then we'll go to Carl.
I have. So on page 15, you tell us that we've got funding from Berkshire West Clinical Commissioning Group to support these 6 officers. How long is that for? That's senior educational psychologist down to an administrator. How long is funding for?
Okay, so the MHST. So we've got funding for the next 3 years guaranteed from NHS England. So that would take us through to, I don't know if people are aware, we've got the long-term plan, which is the 10-year NHS plan. It's split into 2 parts. And the funding from NHS England that's funding this particular commitment within the long-term plan takes us up to financial year 23-24, I think that is. If it's 22, yeah, I think it's 23-24. Forgive me if that's wrong, but I think that's right.
Okay. Are they full-time posts?
So a quick look down. The outreach worker is not, nor is the administrator. And I think the specialist CAMS worker is a part-time post as well. So the senior educational psychologist is 1 post full-time. The primary mental health worker is 1 full-time post. The specialist CAMS is 1.6, an outreach worker at 0.6, and then there are 4 full-time educational mental health practitioners and 1 part-time administrator.
4 educational health practitioners.
That's right.
Full-time. Okay, thanks. And then page 18, just a question about suicide rates. Why do you think that suicide rates are higher amongst people who work in the police than work in childcare?
Well, thank you for the question. I think that there is evidence, certainly from COVID, that there is a higher suicide rate amongst high stress jobs, and I think that the police and childcare sectors would be included in that. I think that frontline healthcare workers are included in that. So I think that it has long been known, for example, that medics or others in frontline healthcare have higher rates of suicide, and I think that it's probably related to similar workplace stress in that respect. I think that in terms of the overall sort of suicide position and the impact of COVID on that, I think we're still at the beginning of that journey or of that story, and I think that it coming over the next few years, so we need to watch it over the coming years. I think that actually suicide there's a varying picture with suicide. Some people get to that position more quickly than others in their mental health illness, if that's somewhere that they will get to and feel they can't come back from. But for some, that's after trying many other avenues. And so we're from a COVID impact point of view, we're at a relatively early stage of that journey. So we need to keep watching. But in terms of occupations and suicide prevalence, there have been clear historical trends with various occupations.
Okay, and then one final question. You told us just 5-10 minutes ago that we're beginning discussions to bring down CAM's waiting times over the next 3 years, which is really good news, because I proposed that in February of 2019, and the proposal was actually rejected, and you suggested that it is quite difficult to get staff. At that time, the council's director of education knew people who she would call on, and probably could have been in post within 3 or 4 months, and CAM's waiting times could have come down from then an average of a year for an assessment to an estimate of around 6 weeks. So I really hope that you are successful in doing this, but I would have hoped that you'll be able to do it in less than 3 years, and I suggest you have a word with Carol Camis as soon as possible.
Did you want to come back on that, Ingrid?
Oh, sorry, it's not our service. Too sorry, Andy.
No, I don't know what to say apart from yes. I mean, we talk to Carol all the time. She's not. I'm quite happy to follow up and ask her those suggestions. Of course, we're going to work as fast as we can. I'm just trying to set realistic expectations that hopefully we'll see some sort of things. So we've got both waiting times in the mental health arena as well as the neurodiversity, the ASD and ADHD in our sites. We've agreed investment in both areas, and we're now going to try and work out how we build the workforce and collect those in. I think we're all aware that they are difficult posts to fill. When we look at our own social work or nursing staff in other arenas, this is not straightforward in the public sector in the South East, with a number of factors behind that.
Thank you.
Okay, Carl.
Thank you, Alison. Yeah, I've got a couple of questions on Willow House. First is the bottom of page 18, when it talks about this decision to close the inpatient building. It says it was a joint decision made by the CCG and BHFT. Just interested to know whether we had any input to that, or whether we had any ability to complain, prevent, or in some way stop that. Or I don't understand whether we even have that possibility. So just interested to know that. And the second question is, obviously it's changed to, there's been some kind of review, and the new system is suspected to be better. And you mentioned it being able to cope with 16 patients as opposed to 9 full time. So I'm just interested to know when we likely see evidence of the outcomes from that, so that we can kind of sit down and actually say, yes, that has been better or not.
So first of all, an apology. That's a mistake in the report. It wasn't a decision by Berkshire West CCG. It was a decision by NHS England and BHFT, and we were just parties like yourselves to that decision. And it wasn't a decision that locally we were involved in. We were just obviously on the back end of that because of some pace that was required behind it. In terms of outcomes, again, I would suggest it's going to take time because the service is only just set up. So maybe this time next year might be an appropriate time to ask for a specific item back on Willow House. And I would suggest that actually what we need to do is invite BHFT to provide that, because again, I want to be really clear here. We do not commission that service. So it's a bit like asking Ingrid to comment on services that I commission, or myself commenting on services that Ingrid commissions. It's just from an offer perspective, we need to make sure you get the right people in the room who can answer your questions.
Thanks very much. That's great.
I think if you look at the minutes of the last meeting, there was quite an in-depth look at Willow House with questions asked again from page 7 of the agenda. Adrian, you had another question?
Yes, I was present at that meeting and we did get a good Q&A session on Willow House, but I have a further question on Willow House actually. Obviously, there are circumstances, and we understand the arguments that a lot of cases it's better to keep the individual at home and provide services at home rather than in a residential setting. But we all know that sometimes homes can be the problem as well as part of the solution. I mean, the home environment of the individual can be part of the problem. So it is still likely that there will be referrals for some individuals to go into, I think it's Oxford or somewhere else, I'm not quite sure where it was. But one thing that I would be very interested in is to see the numbers who are referred to Oxford and the other locations, so that we can see, yeah, okay, these individuals, it was not possible or not the best for them to have home services, and that they actually required residential in Oxford or wherever. Then my next, so that's a request for a KPI or something on that. The next question is, and I was actually going to come to this, but you've just mentioned it, because BHFT is the delivery team, the execution partner here, we actually need them in the room as well, I think, at the next meeting. I think that would be really helpful, and I would support that request. Thank you.
Right. Does anyone have any further questions for Ingrid or Andy? In that case, I'd like to thank you both very much for coming this evening, for your presentation, and I'm sure we'll be inviting you to return. Thanks again.
Thank you very much, Chair.
Thank you, Chair.
Where's the bird song coming from? Oh. Okay, members, you have been informed that item 7 and item 9 on the agenda, we're going to move to the July meeting. These would have been presented by Adult Social Care Director Matt Pope with the lead member Charles Margetts. Quite obviously, they are working very, very hard at the moment on surge testing and surge vaccinations, so they have given their apologies and asked that we could move that to the next meeting. So we're now going to look at item 8, which is an update on the work of Health Watch in Woking Borough. And we've got Jim with us today.
Thank you, Chair. Yeah, unlike the previous presentation, mine will be a little bit shorter. I apologise, but Nick Durman, who is always my preferred choice to present and talk about this, has inconveniently gone on holiday. So you get the B team or C team. I think the Insight into Action report has already been circulated. So you should have all have seen that, and you'll have seen the emphasis, unsurprisingly, is about how our community is receiving information and on COVID, be it vaccinations, access to certain services. I think we picked up on quite a few residents having difficulties accessing dentist appointments and registering as new patients with an NHS dentist. Subsequently, this has meant some dentists have put on additional evening and weekend appointments. one thing I would say, what I would say about Health Watch at the moment is a lot of our work is about signposting, more so than previously, because obviously we can't get out as much as we used to. So we continue to take a lot of phone calls. A couple of other things that probably aren't in this report, but I just asked Nick to update me. Health Watch, Woking anyway, actually attended the Asia Mosque last week. And there was a small contingent of VCS organisations working together to provide information on services, with the idea, I think, of running a larger event of VCS organisations in the year at the mosque to share about information about VCS services, and I think to encourage participation as well. We also continue to be members of the CCG vaccination or vaccine action group, and again, I think you may be aware, but all three Health Watches were part of a task and finish group for Berkshire West Joint Health Wellbeing Strategy Project, and we have promoted the survey and held a couple of focus groups to provide input into that strategy, one with adult and young carers and one with learning disability groups. The other thing is we're actually at last finalising our report on the carers' experience during COVID, which we will be making available to all the service providers for comment at the beginning of July. And that, in a very brief run through, is I think bringing up to where we are at the moment. A couple of points, other things I'd throw in from my point of view as a non-exec, apart from, like everyone else, our very tiny team is working very hard. We continue to look for non-executive directors for Health Watch Wokingham. Some of us are getting a bit older, so it's always useful to have someone else on board. And one other thing, which is slightly off-piste, but I mean, there's such strong emphasis about our own wellbeing strategy, and I just reminded myself, because obviously I sit on the wellbeing board as well. It's about narrowing health inequalities, creating physical activities, reducing isolation. I also wear another hat as chair of More Arts, and we've done work over the years where we've looked to support young people through the arts and culture, indeed helping many of them to transition from or up to secondary education. And Wokingham Borough now has a very active Arts and Cultural Alliance, which I'm sure most councillors are aware of, which I'm also lucky enough to attend. And a point I did bring up is that possibly the representation of what arts and culture can do for everybody's mental health and well-being should start figuring in somewhere in our own well-being strategy overall for Wokingham Borough. And as you know, if you're mug enough to open your mouth at any meeting, you usually get volunteered into something. And so that's what I got volunteered into, to try and push that representation into the whole healthy and resilient communities. And I'll leave it at that for the minute. I'll take any questions, and if I can't answer them, I know somebody who will.
Thank you. Councillor Firmager.
Thank you. Yeah, thank you very much for that, Jim. I'm just really looking at some of the cases that actually occurred here, and some of them are quite horrific, really. There's one person here is being treated for a serious illness. So all these
children that do not resuscitate.
Well, that as well. That's on there. Well, that's a bit later down the page. I know that these are all being resolved, but by Health Watch. But I'm just really wondering what's being done to make sure these do not happen again, or similar things don't happen again.
Well, as you'd be aware, I mean, mostly what our action is to approach the service providers and obviously organisations like CCG and in fact the CQC and push those over to them to follow up and ensure that we're not going to slip back into some of these areas.
Can't hear you.
You're muted, Jim.
Apologies for that. I didn't realise I'd done that. I don't know where I got to on that. Answering the question, what is being done, what we do, as you'll see from all of these reports, is we're referring to a service provider. We'll refer them to the CCG. In some instances, we refer to the Care Quality Commission, and then look to them to ensure that these occurrences aren't going to happen again. And where we can be more active, which we're a bit limited to at the moment, obviously, is to test whether that information or indeed those behaviours are still being adhered to.
Yeah, thank you very much for that. Yeah, I mean that's the sort of thing we don't want, these sort of what you call them behaviours occurring again, because they could have some very fatal results at the end of it.
Of course.
Yeah, there's just really one other little thing actually, and this does really wind me up a heck of a lot, and that's the spelling of programme in here.
Oh,
can you please not do an
yes.
automatic spell check, because it will default to United States English, and rather than can we have programme spelt with 2 M's and an E, please?
Yeah, it's okay. I am with you on that one. I didn't check this one before it went out. I'll make sure it doesn't happen again, and I'll put £1 in the charity box if it does for each one. All right.
Yeah, I mean, I'm sure there are other words as well, but that's the most common one.
I know.
In American spelling, I know it's pure English, but it's not the way we spell it over here.
Agreed.
Okay, thank you for that, Mike. Clive.
Thank you, Alison. Jim, thank you very much for the report. I've just got a couple of things to say. Over 13,500 views of your website, 26,000 Facebook posts, 800 plus Instagram posts, over 9,000 Twitter posts. Really good. Thank you very much. And thank you for keeping open in January.
Yeah, we're not quite the Windmill Theatre, but we never close.
But I think it's good for us to let you know, so you can pass on to all of the other people in your organisation. The work that you do really is appreciated, especially in this difficult time.
Thank you for that. And I mean, I would say, and I know I say it on frequent occasions, it is a very, very small paid staff who work way outside their conditioned hours, and it's them who deserve all of the praise. Thank you.
Okay, Adrian.
Again, Jim, we always say thank you to you, and I want to reiterate that again. It's very important we get a heads up on what's going on, and some of the information you gather is really thought-provoking, I would say. You know, I wanted to comment on a couple of cases really here. One, which was, I guess, following on from my moan earlier on about the CCG disagreeing to support the idea of another GP surgery in Wokingham, which I think is ridiculous. You know, the GP surgery in Rose Street has got 15 or 20,000 patients and is not working. And you can see the quote in here and the situation that this resident couldn't get an appointment for love nor money, and I think that's fairly typical because the whole process is overloaded. So we need to think about how we put more pressure on the CCG, especially now we're going to be building more houses around Wokingham. It's going to get even worse than it is now. Is one comment. On the DNR, the DNR is not an easy question. When I'm not working and I'm not in doing this stuff, I'm listening to Radio 4, and I heard a very good program about DNR the other day, and the expectations of the population with regards to DNR. What the experts were saying on the program was that there needs to be more realistic information provided to the population about resuscitation, specifically things like the facts of, maybe 10% will actually get resuscitated if they go into cardiac arrest. And, if you do survive, it may not be the kind of outcome that you expect. So my question to Healthwatch is, if we motivate Royal Berks or the CCG or somebody into doing a communication around DNR, would you be willing to support that, and would you help with that?
I mean, well, I think the answer to that is yes. If it is, obviously, as Healthwatch, you are there to point and I think also explain. And explaining what DNR means and its impact, it's not, as you allude to, it's not as simple as saying, oh, well, that's all right, you turn everything off. And many of us, of course, I think have lived with such a situation within our own family. So we're aware it's very complicated, can be a very complicated process. But having a simple, articulate guide, this is what it means. I think it would be highly valuable. I mean, I'll push it into our team anyway, or into Healthwatch Wokingham as an area we should look to develop, and we'd work with any of the principal partners in that to, one, put some words into it, and also to help distribute that information.
Thank you very much, Jim.
Okay, I'll follow up on that. I'll drop a note to within the team, though I'm sure it will be picked up in the minutes anyway.
Okay, I've a question for you. It wasn't highlighted as one of your case studies, but have Healthwatch been contacted by residents wanting face-to-face GP appointments, but they've been off phone or video consultations? Has that been an issue locally?
I'd have to, in truth, I'd have to refer back to that. But I think I know that the answer is yes. There have been people who have wanted face-to-face, and I don't want to be, it's not necessarily an age thing either. So I'll ask the question to see how many issues have been raised on that, and we'll come back onto that one.
Thank you. Members, does anybody have any further questions for Jim? Okay, in that case, I'll just echo the praise and thanks. And I'm sure all members join me in thanking you. It is a statutory service, not a voluntary one, but we know that the small team you have go absolutely above and beyond, and it is really appreciated. So thank you for everything that you do at Healthwatch.
No problem. Thank you very much. I wish you all a happy evening.
Okay, so we're now looking at the forward programme for the year ahead. We're a little bit hindered in that we would have heard from Charles Moggetts and Matt Pope about the programme for the Adult Social Care Department for the year ahead. So we would have been able to see if there were new projects, new strategies that we would particularly want to scrutinise. So I think we can do some work tonight on the programme for the year ahead, and we'll look at it again in the July meeting and see what else we might want to add. So we have standing items. Obviously, we welcome Jim or Nick from Healthwatch to each meeting, as well as the health consultation report. I have asked Charles and Matt that we look at the KPIs for adult social care. where the KPIs fit with our meeting, I think it's important that we are able to dig deep into those. Although they are presented to OS management, they are looking at, you know, the entire council, and it's not possible to look at it as closely, as some of those items need to be investigated. So at the next meeting, we need to be looking at both the priorities for the year from adult social care, but also we've got the item that's been deferred, the joint health and scrutiny arrangements for Bob. So, and I think we can certainly be looking at the KPIs for January to March. I'm not sure if the April to June wouldn't be ready by then, would they, Madeline? No. Okay, so one item that we've been passed by corporate and community is to look at public toilet provision across the borough to make sure that we've got enough, that they're in the right places, that our residents, you know, when they need to go, there is somewhere to go. So I'd like to suggest we look at that in September. And we've also, as Adrian highlighted, there's a lot of concern about GP practice provision across the borough. So I think to look at that as a major item in the November meeting. Do feel free to pitch in, members.
I've got lots to say, but
Okay, and then the other key thing, of course, is looking at dentistry provision. Whether we could look at, Madeline, did we have a suggested timetable for that? Would it be September or January?
It'd be more like September.
Yeah. Yeah, and then of course, floor's open as to what else you think this committee should be looking at. Adrian.
I mean, I think you've hit the main nails on the head, to be honest. Obviously, there's a major change with the long-term NHS plan with you know, Bob especially. I would be very, very interested in reaching out to Bucks and Oxfordshire and seeing if we can get I don't know, 2 or 3 meetings a year as a collective to understand, you know, where they're at, where we're at, how the transformation to Bob is going, and weak spots and things like that. I think the public toilets, I mean, I'm astonished that we've, you know, I remember the days when I used to use public toilets. I can still remember those things being existing. And, you know, people say, well, why is there bad behavior? Why are people urinating in the street? Well, there's no public toilet. So I think this is an important topic which has been ignored for many, many years. And I'm very pleased to see it on our agenda. I've been asking, I think it's the 12 months, maybe 15 months to get the dentists to talk to us. I don't know if Jim's still there, but Jim explained there was one case of, I think it was a resident in Norris who was taking their own teeth out with pliers because they couldn't get a dentist. You know, this is not an issue that's far away from us. It is in this locality, and a lot of us in this locality think we're well off, and some of us are, but some of us aren't. And we need to think about those people who are really struggling with dentistry. And I think this is a massive issue. You know, the information that you get from dentists is, if you start with a dental problem, this leads to all sorts of other issues as well. So I'm very keen to get the dentists in here and to see what their problems are as well. I'm not expecting 100% solutions, but that for me is, or dentistry is a critical element of proactive care. And, you know, I don't think anybody in the country is doing a very good job with it. And I think we need to somehow turn that around if we can. I'm also very interested in an update from the chief exec of Royal Berks or BHFT, whatever you want to call it, with regards to their submission to the Treasury and ultimately to Boris Johnson's office, I guess, with regards to funding and options for remodelling or rebuilding Royal Berks. That, you know, this committee has supported the chief exec of Royal Berks, and we've had some very agreeable conversations. But I would like, you know, maybe in this next 6 months to cross-check with the with that organisation to see how they're getting on with that, and to see if we can support them to get some more money for us locally to get a better hospital that's not falling down. For our residents to have care, I think is a really massive thing for me. I would rather our residents be treated in a building that's not falling down.
Okay, I don't think anybody would disagree with any of those points, Adrian. So let's see if we can get them all onto the programme this year. Clive.
I was going to suggest the update from the chief executive of the RVH, who is now back in post because he was away working on test and trace, but Steve McManus is now back. And I would suggest that we go for the 8th of November, because they will probably have had an initial indication from the Department of Health by then. They are certainly expecting it over the summer, early part of the autumn. So 8th of November would be quite a timely time to have it. And I'd like to have an update from David Birch at Optalis on changes that he sees coming up in Optalis, what extra work he may well be considering doing for Wokingham Borough in the coming years, and an update on how the relationship with the Royal Borough of Windsor and Maidenhead is, because I understand that it is now much better than it was.
Yeah, I think when we hear from Charles and Matt at the next meeting, Clive, they'll be able to give us an update on changes with Optalis. But I think certainly having Optalis as an agenda item coming up possibly in September, because there are changes afoot, aren't there? So we don't want to put that any later.
And I do think it is worth having a conversation with David Birch as well, because he is a person that is going to be managing Optalis under the direction, you're right, of Matt Pope, but or working with Matt Pope. But I think he is definitely a person that we should be able to ask some questions of. Thank you.
Anybody else have any items that they think we should put on the agenda this year? Oh, Tahir.
Thank you. I'm not fully aware of the scope of this committee at the moment, but I wanted to suggest looking at the ambulance service. There seem to be a number of issues that I get emails about separately, and some of the their functionality and operational efficiency and so forth. And they're a critical service to everything that goes on, really. So I think that would be very useful to look at if we can.
Yeah, I think we should certainly look to put that on the agenda. January?
Yeah, that'd be fine.
Okay, Madeline, do you need to add anything about? Okay. Anyone got any further comments? Right.
Just one comment. It's been an extremely efficient meeting, I must say. Thank you very much, Alison.
Well, we were missing 2 major agenda items, so.
That's the secret then.
It is. I mean, I suspect for some of you, it's the first time you've been in the chamber for a public meeting, and it is an interesting experience. You're very fortunate. You can all see these screens clearly. It's very, very difficult for me to read them. That's what I've learned. Okay, in that case, I'm going to bring the meeting to a close. Thank you all very much for attending, and huge thanks to Callum and Madeline.